Dear colleagues, good morning. It's already time for us to start this webinar. I want to welcome you on behalf of the Global Social Service Workforce Alliance to the webinar on the I would like to welcome you to the webinar on the role of the Global Social Service Workforce Alliance as a forum to advance knowledge and advocate for policy reform. I'm Natia Partskhaladze, the Alliance Senior Technical Advisor, and today I have a pleasure of facilitating this webinar together with Aaron Greenberg, our steering committee member and Child Protection Regional Advisor for UNICEF Regional Office for Europe and Central Asia. Before joining this post in Geneva, Switzerland, Aaron served as Chief Child Protection in the country offices in Myanmar and in Georgia. And in Georgia, I had the pleasure of working in his team. As I've mentioned, I'm the Senior Technical Advisor at the Alliance, and I'm based in Tbilisi, Georgia. Today we have a rather full agenda. However, we will make sure to save some time for the Q&A session. So I suggest that you type in your questions during the presentations or after the presentations in the chat box, and we will have time to discuss and come back to your questions. The idea of organizing this webinar came from the Alliance member survey. The new members of the Alliance wanted to learn more about the work of the Alliance and the ways how they could benefit from or contribute to the work of the Alliance. We've decided to organize this session twice. One was organized day before yesterday for the participants in the US and the time zone, which is more convenient for people in that part of the world. This time we are trying to accommodate participants in this time zone, and I hope it makes the participation in the webinar much easier for you as well. Now I will ask Aaron to start the presentation, and I would like to thank him very much for being part of this webinar and for supporting the Alliance in its work. Aaron, the floor is yours.
Thank you, Natia. Hello, everybody. I will start with a little bit of background about the Alliance, which is quite important to understand where it's come from and where it is today and where it's going. It was launched in June 2013 as a network, but it came out of a conference in 2010 in Cape Town, South Africa. Essentially, it was funded and pushed for by the crisis of HIV/AIDS in East and Southern Africa, primarily. So the President's Emergency Fund for AIDS Relief within the US government, motivated by a range of stakeholders, came to the realization, which many of us on this call would already be familiar with, that the crisis of many people losing their lives to AIDS in that region was a crisis of care and support for vulnerable children and families, which required large investments in social work and in the social service workforce. And the workforce at that point was defined to be very broad in scope, and we'll get to that in a minute. But I think it's really important to understand the origins of the Alliance and where it's come since the origins of its sort of birth, if you would, so that you can get a sense of where it's going and how it's expanded and what its new challenges and opportunities are. It was established in 2013 after that 2010 conference, which essentially realized and established that this was going to be a needed platform for multi-sectoral work to advance good practice, knowledge, and advocate for workforce improvements that will lead for better outcomes for children, families, communities, and vulnerable groups. The idea was that the services that were needed and are needed by vulnerable children and families are largely a human service. Human services made up of social workers, paraprofessionals, psychologists, social pedagogues, and other professionals across the social service workforce, and not necessarily an investment in infrastructure, or at least a very small portion of it is an investment in infrastructure. And that in order to better deliver the required support and the approaches for that support, that there really needed to be a spotlight put on the workforce and the needs of the workforce. Currently, it's funded by UNICEF, by a foundation called GHR, and as I said, its prior funding was largely from USAID during its origins for the reasons that I stated before. The Alliance Secretariat is based in the US, it's based in Washington, DC, and again, that is partly due to the history of its origins. And this TIDES Center acts as sort of the fiscal sponsor and host. That's the TIDES Center, don't be distracted too much by that. It's simply an administrative entity which helps the Alliance Secretariat to manage its funding, to pay its staff, and to essentially keep the shop open and running. It has 5 staff based in 4 locations and a globally representative steering committee, which it has now welcomed 6 new steering committee members who are joining this May. And the 6 new steering committee members, I think it's worth reflecting a little bit on, they are deliberately coming from new regions. The Alliance is recognizing that its global nature, it needs to be better represented in the steering committee, and so we see a lot of new steering committee members coming from Europe and Central Asia, and from Latin America, and from other parts of the world. And I'll reflect on this as we go through the presentation some more. Next slide, please. So just very quickly, the vision is to work towards a world where a well-planned, well-trained, and well-supported social service workforce effectively delivers promising practices that improve the lives of vulnerable populations. The mission is to promote that knowledge and evidence, to promote resources and tools, and to motivate for political will and action that's needed to address key social service workforce challenges, especially within low and middle income countries. But I should say that there's a lot of learning and experience exchange from high income countries. Recently, we had a meeting in Europe and Central Asia of governments and civil society from across the region, in which the social work senior advisor for the government of Scotland and Sweden joined to learn from the experiences across the region, but also to reflect on their own experiences. The approach is both to serve as a convener, to advance knowledge, and to advocate, essentially. Increasingly, the Social Service Workforce Alliance is also taking on responsibilities for mapping investments in social work and social services and providing some technical support through certain mechanisms. Next slide, please. Excuse me. So how do we do these 3 things, right? We convene and connect. And convening and connecting, we have 29 webinars a year, roughly. 29 is quite an exact number, but we hold a number of webinars on a number of emerging issues around the social service workforce. We have an annual symposia. We've had 5 to date. We have panels and workforce conferences, relevant conferences. The Alliance represents the interests of the Global Alliance, and we have a website, member directory, and discussion boards as well. The Alliance advances knowledge by developing and disseminating tools and reports. There are sort of special subgroups and joint products that we develop. There are sort of email updates, blogs, and of course there's the website Knowledge Hub, which contains a lot of updated information, knowledge around the issue of the social service workforce. Advocacy. Every year, the Social Service Alliance produces the annual State of the Social Service Workforce Report, and issues this report at its symposia and its Social Service Workforce Week. We also have an ambassador program made up of a number of committed individuals at country level from across the world who act as ambassadors for the Alliance, advocating for people to join, to become aware, and also advocating the approaches that the Alliance promotes. There's an advocacy toolkit, call to action, also a strong social media presence. Next slide, please. So the Alliance membership, I think it's this is where I come back to the origins of the Alliance and the distribution currently of the Alliance membership composition by region. You can see here that nearly half, we can say half, are represented by Africa, but you also have strong representation from the Americas, a growing representation from Asia Pacific and the European region, a much smaller representation from the Middle East. But if we look at over time, if you look at the establishment of the Alliance in 2013, and you look at where it's come between then and now, we see growth in the other regions quite a bit. And that is because the Alliance is growing in its scope and relevance across multiple regions. And that trajectory of the development of the Alliance stems from its origins, as I explained earlier. The membership composition by stakeholder group is also largely a product of where the Alliance started. We have a strong representation from NGOs and the academic and research and training sector. We have a growing representation from governments and UN agencies and professional associations. And I think this is an important growth. NGOs and academic and research training institutes were very much on the forefront of the HIV/AIDS crisis because of the money that was injected into that, mostly from the President's Emergency Fund, but from other sources, was directed largely to NGOs. And so it's not a surprise that there's a strong representation of NGOs. And I think if you correlated the representation from NGOs, largely that would be from Africa, but not only. And so we see that also the growth of the membership composition we envisage to continue to grow in the directions of other regions and of government, UN agencies, and professional associations, and potentially corporations as well. Next slide. So this is quite a critical slide, because this slide is the slide that frames everything essentially that the Global Social Service Workforce Alliance represents and promotes. And it is a simple yet very deep and complex presentation of some concepts. The fundamental concept here is that you can't make progress on reaching and serving clients from vulnerable populations unless there is a planning of the workforce, a strategic approach to planning the workforce from an HR perspective, from a recruitment perspective, from an alliance perspective. And in many cases, if you go to the national level, this often requires the attention of government. In addition, I mean, one can see how planning the workforce would be important for an NGO, hiring and recruiting social workers or social pedagogues or paraprofessionals. But planning the workforce at a much larger level across ministries of social welfare, across ministries of justice, who increasingly hire social workers and social service professionals to administer diversion programs and alternatives to detention, looking at the workforce composition that might be embedded in health and education, requires a bit of long-term planning to understand what are the policies and priorities of the government and the actors around the table over the next 5 years, and what is their demand for social service workers across a range of workforce typologies, and what are the partnerships with academia, civil society, training institutes that need to take place and need to be in place in order to ensure that the professionals who are being produced by those entities are meeting the demands of the planning cycles of large sort of large agencies and departments that hire and deploy and need this workforce. But planning the workforce, you would then find elements of supporting and developing in a plan of how to recruit the workforce. And so supporting the workforce is really looking at performance management, tools, resources, and initiatives to improve job satisfaction and retention, recognizing that there are very high burnout rates in the social service workforce and the social work profession, supporting professional associations in their efforts to enhance the professional growth and development of the social service workforce. So supporting the workforce goes all the way from looking at the role of professional associations to promote the workforce and promote the interests and needs of the professionals in those employment areas. But it also talks about the supervision, the oversight mechanisms, the middle management, the support structures that need to be in place in order for the workforce to deliver effectively. And then, of course, developing the workforce is also important, and this is more on the education side. We spend a lot of time on this because, as we all know too well, most of the social service workforce is oftentimes not necessarily hired with the right background or degree for the work, and is then provided with a very small sort of tokenistic training. It's not always true, but it often is. And we can't expect the workforce to deliver on the requirements of those that hire the workforce unless they are trained effectively. And so this also speaks to the interface in the planning modality between universities, training institutes to ensure that their curricula is modernized, is contextualized for the national and local situation, and that the pre-service and in-service training modalities are robust and not tokenistic. All too often, I hear in my own work frustrations from managers that social workers and social service workforce are underperforming. But then when you actually unpackage who they're hiring and how they train them, you see that their frustrations are of their own making. And so developing the workforce equally as important as supporting the workforce, and all has to be done within a planning framework. So really elevating the importance of the workforce through these three modalities and making it clear to governments, civil society, all actors, that really you cannot expect the social service workforce to deliver on its mandate unless you take all of this quite seriously. Next slide, please. So let's get some examples going, which I love. This is my favorite part. And these three examples are very interesting for me because they all speak to a slightly different level of engagement. So in Georgia, in the Republic of Georgia, there is a recently adopted law on social work, which outlines the transitional stages for introducing regulation, education, and support requirements for social workers and parasocial workers. Essentially, in Georgia, they have two social work degrees, and in the country, which are fairly good degree programs, churning out, producing 4-year or 3-year degreed social workers. They are not hiring those social workers into the social work positions. And I'm sure many of you sitting around this webinar are familiar with this phenomenon. There's been a lot of advocacy to try and change that. Of course, that doesn't change overnight. The bottlenecks are many. The pay scales don't match the requirements of those who graduate and who see themselves as not having to, wanting better working conditions and wanting better salaries. There are issues around how do you get social workers out into rural communities who are trained and come from big cities and don't necessarily want to be out in rural communities. They want to be closer to their families and their homes. So there are a lot of issues to unpackage there, but Georgia adopted a law that essentially says we will grandfather in, we will make sure that the paraprofessionals, the social workers who are now employed by the government, receive a robust new certificate training, which they are tendering at the moment. The Ministry of Education is tendering the certificate training, and that certificate training will be very robust. It won't be a light 5-day training. And then people who go through that training who are currently on the job will be allowed to stay on the job as social workers, full-fledged social workers. But as of about 3 to 5 years from now, the law says that will come to an end, and at that point, every new social worker who is recruited into government social work positions will have to be a graduate. Now, this law has required now the government agencies, the universities to come together and to discuss how they're going to make this happen. An incredibly important law issued by Parliament, recognizing how important this investment is, and framing it with important legislation. In Zimbabwe, national policies, range of national policies, are really acting to support the expansion of the numbers of social workers and case management and child protection care workers recruited by the government across all districts. Now, these policies and frameworks are incredibly important in the context of Zimbabwe because they are calling for an expansion of numbers. And as we all know, this is an incredibly important area. The burnout rate, the caseload rate of the social service workforce is oftentimes incredibly high. And without increasing the numbers as well as the professionalization, this is a serious problem. In Romania, already, and now we move to a country that is an EU member state, a member of the European Union, which now has a law on the protection and promotion of children's rights and a law on social assistance, which defines social workers as individuals with a universal level social work degree. So whereas Georgia has introduced a law with a transitional period beyond which everyone will become like Romania, you will have to have a social work degree in order to be a social worker, Romania has already moved to that point. And many of the Social Service Workforce Alliance members in their individual capacity, in their organizational capacity, have contributed to this work, and the Alliance has promoted and this type of examples to other countries. Next slide, please. Continuing with a few other examples, Uganda has streamlined and really linked up the government and university training programs to ensure national standardization among all local government social workers. This is incredibly important. I'm personally very interested in this area. I'm really happy to see many governments taking initiative in this way, because what we see, and certainly in the region of Europe and Central Asia, is that there is no longer a country across Europe and Central Asia, and we're talking about over 50, 60 countries, that does not have a social work degree. That is an accredited degree program. There isn't a country that doesn't have one. Turkmenistan is the last country in Central Asia. It now has one. And Turkmenistan has developed a very good social work degree program. So this idea of the government working closely with these universities to say, this is the type of workers that we need. What kind of training are you giving? How do we make that training more practice relevant? Yes, theory is good, but how do we get practice placements into government departments to motivate people to see this work on the ground as they're learning, to contribute to it, to see themselves in this work after they graduate? So really important synergies that can't be done unless these entities are talking to each other. In Serbia, qualified social workers are required to engage in continuing education from an accredited training program. Serbia, which is an EU pre-accession country, that is, they're not a part of the EU, but they are gearing up, hopefully, to become a part of the EU in the next decade or so, is advancing this in a way to say that if you're a qualified social worker, you have to continue your education from one of a few accredited training programs. And that is then tied to the renewal of their license from the Chamber of Social Welfare. So, we see as systems develop more, different ways in which governments and training programs interact to make sure people have the skills that are necessary. And globally, paraprofessional guiding principles and competency framework has informed nationally recognized training in a number of countries, including places like the Democratic Republic of Congo, India, Zambia, and other places. Next slide, please. Indonesia, moving on to another region, we see a lot of engagement from professional associations of social work and social work councils, which oversee the examination, registration, and licensing of social workers. So governments recognizing, and the government of Indonesia recognizing, that they don't need to do this. The government doesn't need to oversee the examinations and the registrations and the licensing of social workers, and that professional associations are not just advocates who put pressure on government and say, you know, what's working well and what isn't, and advocate for improved conditions. These associations also play an incredibly important role in fulfilling the tasks that are required to ensure quality as people move into the workforce. And it's not only government that should be concerned with that. It's all entities that hire and deploy social workers and social service workforce. In South Africa, National Supervision Framework and Supervision Policy aims to develop supervisory capacity. Really, you know, and you know, there's so many levels to this, and those of you that are around the webinar, I'm sure are very familiar that you're as good as your supervisor, you're as good as your colleagues, and supervisory capacity is about transforming the relationship between middle management and frontline actors to make it more supportive, to make it more accountable, to make it a bit more relatable to the work that these people do on the ground. Oftentimes, supervisors don't necessarily come from this field and don't understand it. And so South Africa is working on that quite hard at the moment. They see this as an important gap. In Namibia, there are now national guidance and tools to ensure strengthening supportive supervision and coordination of government and community level actors. And so you see similar work in Namibia as we do in South Africa. Next slide, please. So now we turn to UNICEF, and we do this, well, partly because UNICEF is playing quite a big role globally, regionally, and at country level to promote and invest and work with government and partners on the social service workforce. And there's a reason for that, because UNICEF's new strategic plan covering the years 2018 to 2021 has 5 outcomes, and outcome statement 3, which is one of the 5 outcomes for UNICEF globally, is on child protection. It talks about girls and boys being protected from all forms of violence, abuse, exploitation, and harmful practices. Now, one of the key strategies for addressing that, then there's two major strategies for addressing that, is that countries have strengthened child protection systems, and that those systems are really reliant on social service workforce. The social service workforce comes out very strongly in our strategic plan. And so what we're seeing, and I'm very thankful for this myself, I've been advocating for it within UNICEF for quite some time, is that in child protection, largely, not only, but largely, we're talking about the workforce. Whether you're talking about a child who is a victim of trafficking, whether you're talking about a child who is a victim of violence, abuse, and exploitation, a child who has spent a decade in a large institution and needs to be found a family, a child who is recruited and used by an armed group or an armed force and needs to be demobilized and reintegrated. All of those issues require somebody to look at the best interests of that child, to determine with family members, with other actors, what the role should be of different folks in getting that child back into a safe, loving environment. And we are promoting, as we all know now, deinstitutionalization, the closure of these facilities which we know harm children, and that we know children thrive best in families and communities. And in order to do that, we need to work with families and communities on the issues that they face in caring for their own children. Issues like alcoholism, drug abuse, mental health issues, issues of lack of access to services, discrimination. And these things are tackled by humans who engage, people who engage in a way that they can impact on that in a positive way. And that's not easy. That's very difficult. And it requires certain interpersonal communication skills. It requires community mobilization and community engagement skills. It requires some professionals having tertiary degrees in psychology, child psychology, in speech therapy. It requires others to have tertiary degrees in social work. It requires a much larger social work, social service workforce, outreach cadres who are not necessarily responsible for statutory work, that is legal work on children in conflict with the law or removing children from families, but who are involved in everyday outreach from health and education systems. So UNICEF, thankfully, has seen this as incredibly important and has put a huge emphasis on this in the strategic plan. And I do think that if you haven't seen it already, you will see UNICEF working a lot more in this area with partners over the coming years and hopefully decades. Next slide. I think I'm finished.
Yes, Aaron, thank you very much for your very interesting presentation. You have reflected on the history of the Global Social Service Workforce Alliance, which does affect the definition which was developed by the Alliance a few years ago. And that definition was developed with the participation of the professionals and paraprofessionals, as well as academicians and policymakers from different parts of the world. But as you were mentioning earlier, it was very much influenced by the position of the members of the Alliance from Africa. Because the definition of the social service workforce is an evolving concept, we decided to revise the definition. And the one that you now see on the slide was recently developed by the Alliance. So with the inputs from the members of the steering committee, as well as other members of the Alliance. We are planning to organize a broader consultation process on this definition. For a moment, the definition says that social service workforce is an inclusive concept, which is referring to the workforce employed in government structures as well as non-governmental organizations. What is important that the definition of the social service workforce considers not only professional workforce representatives, but also paraprofessionals who don't have relevant academic degrees in social work or related fields. These are people who are working with children, but not only. They are working with young people, adults, older persons, families, and communities to ensure healthy development and well-being. Social service workforce representatives throughout the world are supposed to be working on preventive, responsive, and promotive services, and their work should be informed by humanities and social sciences. Very importantly, it has to be informed by indigenous knowledge, discipline-specific, and as well as interdisciplinary knowledge and skills, and ethical principles. Social service workforce representatives engage not only with the individuals, but also with structures and organizations in order to facilitate access to needed services, to reduce poverty, to change and reduce discrimination, and prevent violence, abuse, neglect, as well as separation of children from the families. And no matter what is the context, the work of the social service workforce representatives has to be informed with the principles of social justice and human rights. But what's very important to mention in this definition that because the context of the work of the workforce representatives is so very different in different countries, this proposed definition will have to be contextualized and adapted to the local country needs. And one of the areas where the adaptation seems to be most important and most commonly done is the role of the volunteers in the workforce. As you know, in many countries throughout the world, volunteers are considered to be part of the social service workforce. And these are the countries where the volunteers are responsible for providing many basic services to the representatives, to the population in the communities, especially in the remote locations. However, in more developed countries with more developed social service systems, volunteers are not considered as part of the social service workforce, and this is pretty much true in the region of Europe and Central Asia. And this is one of the parts of the definition which is being debated very much among the members of the alliance and is being adapted based on the context of the country. The definition is also accompanied by the commentary document, which provides more details about the roles of the social service workforce representatives, about their academic education, supervision system, importance of code of ethics, and many other components. So this is the definition which is used very widely, not only by the Alliance, but now also by the UNICEF and other partners. So I invite you to look at our website and refer to this definition whenever you need this in your work. What is very interesting about the social service workforce that it's very diverse, and different titles which are being used to refer to the social service workforce representatives are used and are considered to be a challenge, but at the same time to be a strength of the workforce. Of course, the largest group considered under the social service workforce are social workers, but even that title is not used similarly in all countries. You know very well that this title is not always reserved to the qualified people who have academic education in social work, as it is defined by the International Federation of Social Workers and in general the global definition of social work. And the understanding of the social work title is also very different in different countries. These other titles which are listed on the slide are only a few examples of the titles we came across during our work in different parts of the world. Many other titles referring to the social service workforce representatives were identified during our work in different parts of the world on mapping and assessing of the social service workforce. Currently, we're collaborating with the UNICEF headquarters as well as regional and country offices in order to support them with the mapping and assessment of the social service workforce in East Asia and Pacific region, as well as Middle East and North Africa, and we have recently completed similar work in the countries of South Asia. The aim of this mapping exercise is to help countries to develop the baseline understanding of the situation of their own workforce in the governmental and non-governmental settings, because we all know that unfortunately the data around the workforce in the countries is very scarce. And in order to properly plan for the future development of the workforce, the data is the key and it's very important. The methodology that we use for this mapping is a kind of mixed kind of methodology. What we do is we do the desk review of all documents relevant to the social service workforce available in the country, being this legislation, policies, programs, or different reports available around the workforce. We also do the in-depth assessment using two different tools developed and piloted by the Alliance. This is a worker survey, which is looking at the perceptions of the social service workforce representatives about their own training, about their roles, available supervision, career development opportunities, and many more. Another tool is looking into the administrative data in order to define the numbers, ratios, qualification, and many more of the government and non-government workforce representatives in the country. The reviews include country visits. We conduct key informant interviews and focused group discussions, but very importantly, all this work is led by the country-level task groups, led by the local ministries and composed of the key representatives of the workforce and decision makers in the country. And it's very important because only through the ownership of similar groups, the findings of these reviews will be useful for the countries for their future planning and strengthening of the social service workforce. I would like to mention here that we are now working with the UNICEF headquarters on the development of the toolkit. And one of the tools in this toolkit will be the country level mapping tool. So for the countries which have not yet done the mapping, we will be offering this toolkit, which will provide a step-by-step guidance for carrying out national workforce assessments. The toolkit will be available for the public later this year, and so feel free to reach out to us if you are interested more in this work. The findings from these regional reviews will be included in our annual social service workforce report, which will be launched at the Alliance Symposia on the 7th of May in Washington, D.C. The Alliance has produced few other similar reports in 2015, 16, and 17. And every year we are choosing different topic related to the social service workforce and aim to gather data and trends and also showcase innovative and effective social service workforce initiatives throughout the world. We believe that these documents are very useful, especially considering that the evidence around the role and the importance of the social service workforce is very limited throughout the world. In addition to the annual report, we are producing many other tools and resources, and some of those examples are included here on this slide. But I invite you to visit the Global Social Service Workforce Alliance website, which houses more than 800 documents, which can be very easily searched by the region or other keywords. And they are provided to us by the members of the Alliance and other partner organizations, and are very useful for our members in their everyday work. We also invite you to share with us any additional documents that you think might be interesting for your colleagues in other countries. The Alliance is running several interest groups, and our interest groups are member-led and task-focused. They are oriented on specific social service workforce-related issues, which are normally suggested by the members of our Alliance. Recently, we have established the interest group on advocacy. Last year, we were actively working in the interest group on case management. We also have materials produced by the interest group on paraprofessionals and interest group on building the evidence base. And again, if you are interested, these documents can be found on the Alliance website. Let me stop quickly on the work of the case management interest group. The reason why we've established this group was the increasing interest of the members around this concept, because in many countries throughout the world, the case management approach is becoming more and more popular. The interest group members, and there were 75 of them representing different organizations and different countries, have produced the document which outlines the core concepts and principles of the case management in different contexts. And also, very importantly, we have developed the compendium of case management tools and resources. The compendium right now includes around 40 documents, but we've screened up to 200 documents in order to make sure that every document in this compendium is of a high quality and is relevant globally in the development and humanitarian context. And we know from our members that they are using these compendium documents very well. So I invite you to check out the compendium on our website. As Aaron has already mentioned, one of the key roles of the Alliance is to support the advocacy and advocate for strengthening the social service workforce. And one of the important documents that was produced recently in 2018 is Call to Action for Strengthening the Social Service Workforce to Promote Well-being of Children and Families. This is a 2-pager short document which outlines national and regional level recommendations for the stakeholders in order for them to advocate and to support the social service workforce. The call to action is supported by 35 organizations, including very large organizations and influential ones like UNICEF. And this document can be used very easily by the workforce representatives and others working in the country on these areas in order to present them to the governments and advocate for prioritizing the recommendations which are included in the action plan. In order to support the self-advocacy of our members throughout the countries, we have also produced the Global Advocacy Toolkit, which is based on the scientific evidence and research in behavioral sciences, and provides very useful infographics, case studies, and fact sheets, which can be adapted to the country context and used very easily for advocating for your own cause in your own countries. One of the ways how we try to expand our reach and better advocate for the workforce strengthening is through our Alliance membership program. On this slide, you see the list of the representatives of our two cohorts of the Alliance ambassadors, which represent more than 10 countries. And these are the people who, on behalf of the Alliance and with the support of the Alliance, are advocating for strengthening for the social service workforce in their own countries and globally. They often represent the Alliance at different events and also support each other with this effort. We are very much trying to make sure that the representatives of this program are coming from different parts of the world, and we're trying to reach out to them as much as possible. Our next cohort will be recruited in early 2020, so we invite you as well to join our ambassador program. It has been a very successful program, and our current director of the Alliance is coming from the first cohort of the ambassador program, and we have 3 members of the steering committee joining us this year who also were members of the ambassador program before. We're trying to be close with our members, and member surveys are one of the ways how we are trying to keep ourselves informed about your needs and your desires. The last member survey was conducted in January this year, and this slide shows that increasingly people who are members of the Alliance are more motivated about the work and the importance of the social service workforce, and are able to support strengthening of the workforce using the materials and knowledge provided by the Alliance. And they are also able to work with many other practitioners throughout the world on this topic. And sharing this experience very much helps us and our members in their own work in this area. The second slide also shows how the materials from the Alliance were used, and we know that many of our members are using very well the call to action, the compendium, and few other documents that we've produced during the last few years. I know that you won't be able to read the content of this slide, but that's what it says. We're trying to meet with our members in person as much as possible, and this slide lists the events that where the Alliance will be represented during the next few months. So if you're planning to attend any of these events, please watch out for the members, not the members, but the staff of the Alliance who will be attending and presenting at these events. And the one on the Social Work Day celebration at the UN in New York is coming up very soon in April, next week in April. We are organizing more webinars as requested by the members of the Alliance, and I invite you to register and join us on the upcoming events, one of them being organized in April on implementing a global code of ethics. And we know from our work in the countries that this is one of the challenging concepts, not very well understood by the workforce representatives, but more importantly by their employers. So this might be of use for you. And in June, we're organizing another webinar on the role of the workforce in addressing child violence and other forms of violence. So please join us if you are interested. This slide lists the ways how the members of the Alliance can be better involved in our work. And we very much invite you to be more active in communicating with us. Share with us the documents and materials that you are producing and you think that could be useful for other people throughout the world as well. Send us your materials, engage with in the webinars, send us ideas for the webinars and interest groups, and also whenever possible, invite people who are not the members of the Alliance to join our group, because only by extending our reach, especially in this region and MENA region where our membership is not very high, we will be able to better strengthen and support each other in our joint work. This next slide shows the ways how people can register to become our members. And as you probably know, the membership of the Alliance is free. So share it with your colleagues and invite them to be part of our large group. And you can always reach out to us using this website, my personal email address, and email addresses of our colleagues who are always happy to hear from the members of the Alliance. I will stop here and ask you to pose your questions in the chat box. Let me see if you have already done that, and I'll start reading the questions if we have any. And if not, I invite you to ask questions if there is anything that we were not yet able to cover or you are interested in more in-depth information. I think it might be interesting to hear a bit about the work that that is reflected in the 2018 State of the Social Service Workforce Report, which I've mentioned earlier. And I did say that that report includes the information on the mapping and assessment that the Alliance has supported very recently. However, I didn't mention that that report will also include the information on similar work that UNICEF Europe and Central Asia has conducted for mapping and assessing the workforce in this region. So, Aaron, would you like to tell us a few words about your work in your region?
Sure, but I think if there's no questions, we can maybe wrap up after this. But I encourage people to, if they don't want to ask questions, they can write their questions into the box, and then we can try and answer them, or if they have any comments. So in the Europe and Central Asia region, the focus is really on professionalizing the workforce. So you saw in the presentation that the social service workforce, the Alliance definition, is really quite broad. It brings in lots of actors, volunteers, paid, unpaid, and in this region, we really are quite deliberately focused on increasing government responsibility for employing and supporting a larger cadre of social work and social service workforce. And the social service workforce, we further kind of refine in this region to talk about those social service workers who are social pedagogues, who are child psychologists, who are speech therapists, etc., who do require a continued advanced professionalization. As social welfare systems, as social protection systems develop and improve, as university degrees develop and improve, as economies develop and improve, I believe it's our responsibility to hold government accountable and to support governments as the UN, as academics, as NGOs, as civil society, to further understand and advance the bottlenecks that are oftentimes present in many of the countries that we see in this region and beyond, for which there is no quick solution. And that oftentimes isn't a message that many people want to hear. Donors, governments, oftentimes are, and for good reason, looking for looking for solutions and want those solutions quickly. And we understand why. For the populations that they're concerned with, time is not an option. Time is not a luxury. But the reality is that every day that we don't work to plan and invest and collaborate at a larger level on this, we will continue to spin our wheels. We will continue to get stuck. And so the call to action in this region in particular, which was hosted by the Romanian government, and this conference that I mentioned earlier, really focuses in, it talks about a lot of things, but it focuses in on this disconnect between the growing number of social work university programs and really good training programs and the hiring practices of agencies and departments that are responsible for delivering on social work and social services, and really calls on closing that gap and figuring out why is it that gap continues to exist. And that's going to take some time, but we really feel that that's an important place to put our focus. For this region, I would imagine in other regions that's true. I would imagine in many countries across the world this is true. And so it's an exciting platform. It's an exciting framework that the Social Service Alliance gives us. But I also believe that the Social Service Workforce Alliance framework is incredibly broad, and that brings both enormous opportunities but also challenges. So challenges in being that if we say that volunteers are somehow can be counted as towards your social service workforce numbers, then I would be concerned that some entities might say, well, we have 500 or 1,000 volunteers that we recruit every year and that work with our social workers, and we count them as social service workforce as a way of getting around their responsibility to invest more resources in that. Now, I say that while at the same time saying that you can't get this work done without the strong connection to local, motivated, participatory volunteer networks. So while it's true that volunteers and non-paid staff can do a tremendous amount of amazing work, and they are perhaps as important as any other aspect, I am particularly worried about governments and other entities underinvesting in this area, and perhaps some, not all, but some finding ways to say, we don't need to do that because we do this other thing, we support the volunteers. And that gets in the way of the professionalization of a workforce that governments, communities, and everyone needs to address some of the deep vulnerabilities that the policies and the legislation sets out to say we want to address. So I guess those are a few words from my side. I'll stop there and hand back to.
Thank you, Aaron. Thank you. We have an interesting comment here from Heidi, who says that she congratulates the Alliance on the definition that recognizes a broader cadre of professionals. And the reason why she is saying that is that she's well familiar with the experience in South Africa, where the role of the child and youth care workers has increased, and they are playing a valuable role in enhancing the professionalism of this group of the workforce, and they are doing very important work in the communities. And I think when talking about the role of the paraprofessionals, we are always also giving a great example from South Africa, where this group of paraprofessionals has managed to professionalize and enhance its knowledge and skills and evidence base, and are also very good at organizing themselves. They have a strong professional association and are on the right way of increasing and improving their knowledge and professionalizing their own skills. Also, Heidi had a question about how the associations that register social service professionals are funded. And of course, there won't be any one correct answer to this question, because it very much depends on the countries. In the countries where we have worked with similar groups, and if they are funded by the government, the work that these associations have done with the government on advocating their roles as a possible entity who can register the social service workforce representatives counts decades. So I think that that's one of the important points to make, that this advocacy work with the government is not a very kind of short-term effort. However, a number of associations have managed to secure their funding for this role from the governments. However, most of the associations are still relying on donor support, which is, of course, neither sustainable nor available every time. So one recommendations of the call to action that I was mentioning earlier as well is to advocate to the governments to support further the roles of the association, which will be also very much reflected in their funding provided to the associations. Aaron, would you like to add anything to this?
No, thanks.
Yeah, because if not, I think we should finish our webinar here. I would like to thank the participants of this webinar for being with us and for being interested in the work of the Alliance, and invite them to continue working with us, be very active, email us and engage with us, share their resources, and try to strengthen the social service workforce throughout the globe together. Thank you very much, and thank you, Aaron, for presenting here at the webinar. Thank you,
everyone.